Hi everyone, this is a detailed video of mine about seborrheic keratosis. Well, it's a common non-cancerous, benign skin growth. People tend to get more of them as they get older. Seborrheic keratosis are usually brown, black, or light tan. The growths, lesions, look waxy or scaly and slightly raised. They appear gradually, usually on the face, neck, chest, or back. Seborrheic keratosis are harmless and not contagious. They do not need treatment, but you may decide to have them removed if they become irritated by clothing or you don't like how they look. Now I'll tell you the symptoms. Seborrheic keratosis grows gradually. Signs and symptoms might include a round or oval shaped waxy or rough bump, typically on the face, chest, a shoulder, or the back. A flat growth or a slightly raised bump with a scaly surface with a characteristic basted on look. Varied size from very small to more than 1 inch, 2.5 centimeters across. Varied number ranging from a single growth to multiple growths. Very small growth clustered around the eyes or elsewhere on the face, sometimes called flesh moles or dermatosis papulosa nigra, common on black or brown skin. Varied in color ranging from light tan to brown or black. Itchiness. You should see your doctor if the appearance of the growth bothers you or if it gets irritated or bleeds when your clothing rubs against it. Also see your doctor if you notice suspicious changes in your skin, such as sores or growth that grow rapidly, bleed and do not heal. These should be the signs of skin cancer. Okay. Now I'll tell you the causes. Experts don't completely understand what causes a seborrheic keratosis. This type of skin growth does tend to run in families, so there is a likely an inherited tendency. If you have had one seborrheic keratosis, you are at risk of developing others. If seborrheic keratosis is not contagious or cancerous. I'll tell you the risk factor. The peak time for developing seborrheic keratosis is after your 50s. You are also more likely to have them if you have a family history of the condition. Now I will tell you about the diagnosis. Your doctor can usually tell whether you have a seborrheic keratosis by looking at the affected skin. If there is a question about the diagnosis, your doctor might recommend removing the growth so that it can be examined under a microscope. Now I'll tell you the treatment. So a seborrheic keratosis typically does not go away on its own, but the treatment is not needed. You might choose to have it removed if it becomes irritated or bleeds, or if you don't like how it looks or feels. Seborrheic keratosis removal can be achieved with one or combination of the method which I am going to tell you now. First method is freezing the growth. Freezing a growth with liquid nitrogen, that is known as cryotherapy, can be an effective way to remove a seborrheic keratosis. It does not always work on raised, thicker growths. This method carries the risk of permanent loss of pigment, usually on black or brown skin. The second treatment option is scraping, curettage or shaving the skin surface. First, your doctor will numb the area and then use a scalpel blade to remove the growth. Sometimes shaving or scraping is used along with cryosurgery to treat thinner or flat growth. The third option of treatment is burning with an electric current, that is known as electrocautery. First, your doctor will numb the area and then destroy the growth with electrocautery. This method can be used alone or with scraping, especially when removing thicker growths. You should talk with your doctor about the risks and benefits of each method. Some methods can cause permanent or temporary skin discoloration and scarring. After treatment, you might develop a new seborrheic dermatosis elsewhere on your body. Well, this was my video about seborrheic keratosis. I hope you like this video. If you have any questions about this condition, please let me know in the comment section, and I'll try to reply to your comments as soon as possible. Thanks for watching this video. See you in the next video. Bye for now.